Well, let's jump right into this explainer today by challenging a really basic assumption. We are literally constantly bombarded by news and updates. But if we look just past those surface headlines, we usually find a hidden system driving our world. So today, we're going to decode a massive underlying shift that's happening right now. And it's a shift that's changing not just how we treat disease, but honestly, how we solve problems in the entire 21st century. Think about it for a second. When you hear the words medical breakthrough, what is the very first thing that pops into your head? Do you picture some kind of miracle cure? Or maybe a revolutionary new drug? Or this massive, brand new, sci-fi looking machine? I mean, we're basically conditioned to imagine medicine constantly inventing bigger, stronger, and just more powerful interventions. But what if the true revolution is actually the exact opposite? What if real progress is about learning to do less, but doing it with far greater precision?
Take a look at this headline we saw in the news recently. Targeted prostate cancer treatment cuts risk of side effects, study suggests. Now, on the surface, this just looks like a totally standard piece of promising medical research, right? It tells us researchers have studied a new approach, and hey, patients might soon benefit from a treatment that's safer and less disruptive, which is fantastic news, absolutely. But if we stop reading there, we totally miss the real story.
To understand why, we first need to look at the sheer scale of the evidence here. A massive UK study followed nearly 3,500 men over an entire decade. To put that into perspective, a 3,500 patient cohort tracked over 10 years is a highly significant sample size. It absolutely demands our attention. It basically tells us that this isn't just some hypothetical, pie-in-the-sky idea. This is real, rigorous data that is changing clinical reality as we speak.
The actual breakthrough here lies in the method itself, which is called focal therapy. So instead of removing the entire organ, researchers zeroed in on just the diseased tissue. They used techniques like HIFU, which uses really precise sound waves to heat and destroy the cells, or cryotherapy, to literally just freeze the target. Basically, they're treating the specific problem, not the entire zip code where the problem happens to live.
When we compare the two approaches, the results are pretty striking. Traditional surgery and radiotherapy are highly effective, for sure, but they carry a much higher risk of long-term complications just because they affect so much of the surrounding tissue. It's essentially the difference between using a sledgehammer and a scalpel. The study actually found that for carefully selected patients, focal therapy controls the cancer just as effectively as those traditional methods. But, and this is the key part, it spares the patient from life-altering collateral damage. So, the crucial point we need to take away is this. While the prostate cancer study is undeniably fantastic news for patients, the real breakthrough is the massive shift it represents. Because at its core, this isn't really a story about prostate cancer. It's a story about precision. It represents a fundamental, philosophical change in how we approach healthcare as a whole, really moving away from those old blanket interventions.
For decades, medicine relied on the philosophy of maximal intervention. If there was something dangerous inside the body, the safest option was just the blunt instrument. Remove or destroy everything in the general area. And doctors relied on this because they couldn't perfectly see where the disease ended. But today, well, thanks to scanning technology that reveals incredible detail, robotic surgery that allows movements measured in literal millimeters, and AI helping to identify super subtle patterns, we're rapidly moving to precision intervention. The new philosophy simply asks, how do we treat only what actually needs treating? But this shift isn't just technological, it's deeply psychological. When you hear the word cancer, it's a completely human, emotional response to just say, take everything out. We naturally assume that if there's a risk, bigger treatment must inherently mean better treatment. But medicine is gradually discovering a pretty profound truth. More treatment doesn't always equal better treatment. In fact, doing more can sometimes mean doing more harm. Because of this realization, we're actually redefining what treatment success looks like. It's no longer just about survival, it's about thriving. It's a lot like a plant that isn't just kept alive, but is actually flourishing. For prostate cancer patients, that means preserving urinary function, maintaining bowel health, and protecting sexual function. Surviving is the baseline now, but maintaining a really high quality of life, that is the new standard of care.
And here is the genuinely surprising part that makes this shift happen so incredibly fast. Look at these stakeholders for a second. Patients want fewer complications. Doctors want better long-term outcomes. Hospitals want shorter recovery times to free up beds. Health systems desperately want lower long-term costs. And tech companies, well, they have a massive market for better imaging and robotics. For perhaps the very first time in modern medicine, every single player in the complex medical system actually wants the exact same thing, greater precision.
It's a basic rule of human systems, right? When incentives align, progress accelerates. Because all these diverse and often competing incentives now point directly toward greater precision, the speed of innovation in this space is absolutely exploding. We aren't just taking small steps anymore. We are leaping forward because the entire system is pushing in one unified direction. And we can already see this acceleration building over time. I mean, this current prostate study isn't an isolated event. It's part of a remarkably consistent historical pattern where technology continually makes healthcare more selective. Think about it. Surgery went from these large incisions to tiny keyhole laparoscopic procedures. Radiotherapy became highly image-guided. Chemotherapy evolved into targeted therapies. And now, prostate treatment is becoming focal. Technology doesn't just make medicine more powerful, it makes it more careful. What we're witnessing here is the evolution from treating entire categories to treating individuals. Instead of asking, okay, what's the standard broad net solution for this disease? Modern medicine is now asking, what is the precisely right solution for this specific tumor in this specific patient at this specific time? Actually, scratch that. It's more than a move away from standardized medicine. It's a giant leap toward genuinely personalized care. Now, let's zoom out for a minute, because this mindset reaches way beyond the hospital walls. Moving from blanket solutions to targeted precision is quickly becoming the defining characteristic of our modern world. We see it literally everywhere. Education is becoming personalized for individual students. Consumer technology adapts to our unique habits. Businesses tailor products to exact customer preferences. Even artificial intelligence itself is built entirely around personalization. The precision paradigm is the hidden system of the 21st century. So as you look at the headlines tomorrow, keep this hidden system in mind. Remember that progress isn't always about making something bigger, louder, or more powerful. Sometimes progress means becoming more careful, more accurate, and more thoughtful. Ask yourself, where else in our world are we replacing blunt instruments with careful precision? And how might that hidden system ultimately change your own life? Something to think about. Keep observing, and thank you so much for joining me on this explainer.